Have you ever wondered why you behave the way you do? What if we told you that Sigmund Freud might have some answers? Welcome to the Psychology and Physical Training channel, piquing curiosity. Now you may be thinking, Freud, isn't he the one with all those controversial theories? Yes, indeed, he is. But beyond the controversy, Freud's psychoanalytic therapeutic approach holds intriguing insights into the labyrinth of the human mind, potentially explaining why we act and react as we do. So buckle up, and let's delve into the fascinating world of Freud's psychoanalysis. Understanding Freud's psychoanalytic therapeutic approach. Freud's psychoanalytic approach is a theory of personality development that argues our behavior is a result of interactions among three key components of the mind: the ID, ego, and superego. Picture a bustling city. This city symbolizes your mind, and it has three main districts, each representing a different part of your psyche. The ID, the ego, and the superego. These districts are always interacting, influencing your behavior and personality. The ID, it's the wild, untamed district of the city. It's the birthplace of our basic instincts and desires, operating on what Freud termed the pleasure principle. Like a child, it seeks instant gratification, demanding satisfaction for our primal urges like hunger, thirst, and sexual desire. It's impulsive and does not consider consequences. Then we have the ego, the city's mayor, if you will. The ego operates on the reality principle, striving to satisfy the ID's desires in a socially acceptable and realistic way. It's the rational part of our mind that mediates between the ID's demands and the real world's constraints. It's the ego that negotiates traffic rules in the city of our mind, ensuring that the ID's desires don't cause chaos. Finally, we have the superego, the moral compass of our city. It's the embodiment of societal and parental values, the judge and jury that apply moral standards and guilt. It constantly strives for perfection, often clashing with the ID's primal desires. These three components are in constant interaction, shaping our behavior. The ego, stuck in the middle, tries to balance the demands of the ID and the superego. This negotiation can lead to internal conflicts and anxiety, which, according to Freud, are integral parts of the human experience. Understanding this tripartite system is like having a roadmap of our mind. It's the first step in comprehending Freud's psychoanalytic approach, giving us insight into why we behave the way we do. With that foundation, we can now delve deeper into the psychoanalytic therapeutic approach, the focus of psychoanalytic approach. So how do these three components of the mind help us in therapy? This question leads us to the core focus of the psychoanalytic approach. At its heart, this approach is all about unraveling the knots of the unconscious mind. Picture the unconscious as a vast, dark ocean. Underneath its calm surface, there are countless thoughts and feelings swirling and churning, hidden from our direct view. These unconscious elements influence our behaviors, emotions, and decisions, often without us even realizing it. The psychoanalytic approach serves as a deep-sea diving expedition, allowing us to explore these depths and bring these hidden elements to light. Now imagine the ID, ego, and superego as three powerful currents within this ocean. The ID, driven by primal desires, pulls us one way. The superego, shaped by societal norms and moral principles, pulls us in another direction. Caught in the middle is the ego, striving to find a balance between these conflicting forces. When these currents are in harmony, we experience psychological well-being. But when they clash, we face internal conflict, leading to anxiety, stress, and other psychological issues. The psychoanalytic approach aims to resolve these conflicts. It's like a skilled navigator, guiding us through the turbulent waters of the unconscious. By helping us understand the nature of these currents, the ID, ego, and superego, and their interactions, psychoanalysis empowers us to better manage these internal conflicts. It provides us with the tools to steer our own ship rather than being tossed about by the stormy seas of the unconscious. However, this is no easy task. It requires us to confront uncomfortable truths and face long-buried fears and desires. Yet, it's through this challenging journey that we can achieve greater self-awareness, personal growth, and ultimately healing. But how exactly does this approach work in a therapy session? Let's find out. Therapeutic techniques and procedures. The psychoanalytic therapeutic approach employs a range of techniques to uncover the unconscious mind. Now, let's delve into some of these intriguing techniques. Firstly, we have free association. This is a cornerstone of psychoanalytic therapy, where patients are encouraged to share thoughts, feelings, or images that come to mind without any form of censorship. The idea is to let thoughts flow freely, like water running down a stream. Sounds simple, right? However, it's through this process that therapists can identify patterns and associations that may reveal the unconscious conflicts causing emotional distress. Next on our list is dream analysis. Freud coined the term the royal road to the unconscious to describe the significance of dreams. In dream analysis, the therapist and patient work together to decode the symbols and metaphors in a patient's dreams. You see, Freud believed that dreams are a reflection of our deepest desires and fears, often cloaked in symbolic language. So, by analyzing these dreams, we can unravel the threads of the unconscious mind. We also have the technique of interpretation. This is where the therapist interprets the patient's free associations, dreams, and even slips of the tongue, known as Freudian slips. The aim is to uncover the hidden meanings and unconscious desires that underpin these expressions. It's like being a detective, but instead of solving a crime, the therapist is deciphering the complex language of the unconscious mind. And let's not forget transference, where the patient unconsciously redirects feelings experienced in an important personal relationship towards the therapist. This can provide invaluable insight into how the patient interacts with others and their unconscious relational patterns. The therapist can then help the patient understand and resolve these patterns, leading to improved relationships outside the therapy room. Now, you might be wondering why these techniques are important. By bringing unconscious thoughts and feelings into the conscious mind, we can understand and resolve the internal conflicts that cause psychological distress. This understanding can lead to profound changes in feelings, thoughts, and behaviors, providing relief from symptoms and promoting personal growth. These techniques are not just theoretical constructs, but practical tools used in therapy. They help illuminate the dark corners of our mind, allowing us to understand ourselves better and live more fulfilling lives. And isn't that a journey worth taking? Recap and conclusion. So we've explored Freud's psychoanalytic therapeutic approach. But what are the key points to remember? Let's take a moment to revisit the fascinating world of Freud's psychoanalytic therapeutic approach. As we've delved into, this approach hinges upon the dynamic interplay between the ID, ego, and superego. The ID, driven by primal desires and urges, is the raw, instinctual part of our psyche. The ego, the reality checker, works diligently to satisfy the ID's demands in a socially acceptable way. And the superego, our moral compass, strives to uphold societal norms and values, often clashing with the ID's basic instincts. This inner conflict, according to Freud, is at the heart of human behavior and emotional difficulties. It's like a tug of war, with the ego caught in the middle, struggling to balance the demands of the ID and the superego. Now, let's think back to the focus of the psychoanalytic approach. It's not just about managing symptoms or changing behaviors. Instead, it's about delving deep into the unconscious mind, unearthing hidden memories, and resolving past traumas. Freud believed that by bringing these buried thoughts and feelings to the surface, individuals could gain insight into their current struggles and find relief. And how does this happen? Through a variety of therapeutic techniques, of course. The couch, the free association, the dream analysis, all these are hallmarks of Freud's therapeutic approach. These techniques provide a safe space for individuals to express their thoughts and feelings without judgment, allowing the therapist to interpret and provide insight. Now, it's important to remember that Freud's theories are not without controversy. Critics point to a lack of empirical evidence and the potential for therapist bias. However, the influence of Freud's work on psychology and therapy is undeniable. Understanding Freud's psychoanalytic therapeutic approach gives us a unique lens to understand human behavior. It's not just a theory, but a practical tool that has been shaping therapy for over a century. And if you like this video, do not forget to subscribe and follow the Psychology and Physical Training channel for more videos. Thanks for watching.